So was he kicked off of the Medicaid program?
He was kicked off the Medicaid program. I've been talking to different directors. Everybody's given me, I was talking to the Empower line. I was talking to everyone.
Okay.
And since then, we still been paying, but now we really having some hardships.
Sure.
It's been 20 months. So that's why I had called you, because, I've been going everywhere I could to try and get whatever help I can get. Mm-hmm. And I've just been unsuccessful.
Yes, sir. How you doing?
I'm good.
Sorry about that.
Yeah, you're fine. You're fine.
Go ahead.
I was telling you why your wife had reached out, and I said, when she told me about what was going on, of course, I'll let you all tell the story, but in terms of Medicaid, and they made a lot of cuts down there, especially with their personnel. So trying to get things done quickly just doesn't work anymore.
Right.
But when she told me about what you all needed, and she said, well, you're trying to raise to $500, but you also were looking to possibly, until you could figure it out, which could be 2-3 months, end up being about $1,200 a month for the next 3 months. I said, well, this is something that we can try. I can at least get you guys on video, tell us your story, and let's see if people out there are willing to help. And I think that as a community, I think there will be some people out there who do want to help. We just want to see what it looks like. So I said, let's just take a shot at it and give you guys an opportunity to tell us your story, and then we'll just see what we can get.
Okay. All right. Sounds good. Thank you, Tony.
Yeah, you're fine. So you want to start at the beginning, kind of give us an idea of what's going on?
I'll let my wife start it because she
Okay,
kind of.
Okay. In September the 23rd, in 2023, my mother-in-law, who was taking care of my brother-in-law, had passed away. And it happened in June. So we had to get rid of her rental lease property. And so it was September when the lease was up, because we did not live in Georgia. So we had to put him in a personal care home because he needed services. So when we put him in a personal care home, they had told us he was on Medicaid and Medicare already, but the personal home that we had brought him to had said that they would not start accepting, they needed to get eligible for Medicaid, but it will be in 3 months.
Okay.
So we trusted that, and she gave us a price, which was $2,000. And per month, yes, it was $2,000 per month. So to help, because she said nobody else paid that amount, but she wanted to help. She understood. Right. We couldn't take him because our work consists of a lot of traveling. Mm-hmm. And at this time, we just living with my daughter and husband. Okay. So in another state. So since then, I've been applying, giving all kind of different programs, went to Medicaid, and it's been 20 months, and I'm still getting the runaround. So they did give me a notice of a decision, giving me approval, but they was telling me that what I got was not to pay for all of the services.
You wasn't eligible for the whole thing, right?
No.
What was it?
It wasn't paying for the full services. So they were sending me, because they say they have 12 different programs. So they were sending me to different programs. I've been talking to different directors. Everybody's given me, I was talking to the Empower line. I was talking to everyone.
Okay.
And since then, we still been paying, but now we really having some hardships.
Sure.
It's been 20 months.
What kind of services does he need? What are you looking for Medicaid to cover?
Oh, to cover his personal home care.
Okay.
To the personal home care, he has a developmental disability, and I think he's going into dementia right now. He's a little confused. So we're going to be seeing a doctor on June the 17th. So, but since he's been in the personal home, they've been having the doctors to come and see.
Sure.
He's unable to do anything for himself. He has to have the services.
How old is he?
He's 64. I'm sorry. He's 64.
But he still does have Medicare Part A, Part B.
He has Medicare Part A and B, and he had Medicaid.
So was he kicked off of the Medicaid program?
He was kicked off the Medicaid program because they say something about the SSI. Everything, could go wrong, went wrong. And then we went to get that straight with the SSI. So he was put back on Medicaid. And then they was,
Delayed everything. So
everything is keep being delayed because with the developmental disabilities, you need all kind of paperwork from childhood. He doesn't have any of that.
Yeah.
So I did contact legal aid. I did have access to a lawyer, and she told me to apply, and I applied, and I'm still not hearing anything from Medicaid or Medicare or any assistance at all.
Okay. And so of the 2,000, you all have a portion of that. What is you all's portion of that every month?
Well, 1,200 because he get his Social Security and he get 957, and so we take the 800 because he has insurance and we have to get different things for him, and we put the 1,200 with the 800, and we've been doing this for 20 months now.
Okay. And the facility, first off, one of the things I'm always talking about is families have to help each other. And I think that because it happened so fast, families were not prepared for what was going to happen, which is we are seeing a lot of people stripped from Medicaid, unfortunately, and we're trying to figure out a way around it. And I think family support is the one way, but that is a lot to burden, a lot to carry for you all. So what is your timeline, and what can we as a community do to help? What is it that we could do to help you? And the next question is, if we were to figure out a way to help, is Medicaid going to actually kick in 2 to 3 months, or would you just need help ongoing for as long as he's there?
Okay, well, from I'm understanding, I've been talking to the director, and she said she keep telling me that she got someone to help us out. It would happen, and she's been telling me that for
the last 21 months.
For 12 months. So I'm believing her. I'm believing that we're getting closer to something happening. But right now, we need help right now. I know it would probably take 3 months or whatever. Everything is being delayed. So I'm just going on, each month we have to continue paying. Okay. And the timeline is, well, I told her he doesn't get his check until on the 3rd. So she does, I give her part of the money on the 3rd, and then by the 15th, I have to have the rest of the money.
Okay.
So she did, they're doing the best that they can, but they run in a business, of course.
Sure. And they're also doing, from my understanding, so this is in Georgia. This is the east side of Georgia. So $2,000 a month is really phenomenal, right? And just full transparency, I think the lowest I've ever seen, well, not ever, the lowest I'm seeing right now for personal care home is about $2,750, $3,000 on the low end. So for them to be able to do that for $2,000, it actually says a lot to the character of the place. So that is a huge plus, and I'm just giving you that side of it. So what I think now is to figure out, okay, today's the 11th, and you need the money by the 3rd. Is that what you're saying?
No, by the 15th, I need the rest of the money. $500, yeah.
Okay. So what we'll do, today's June 11th, I will put this out there for people. I think we got enough of a story to kind of see what we can do. And then what we'll do is we'll just kind of circle back. If we get it out first thing in the morning, I'll know by Friday afternoon how it's doing.
Okay.
I'll know by Friday afternoon. Because this part of it we won't put up there, but I'll know by Friday afternoon how it's doing. And then I'll be able to kind of gauge what we rate if we raise something, right? And then I'll talk to my office as well and see what we can do to help. Because it's a lot. I know it's a lot. Yeah,
it's a lot. It's a lot.
Yeah, I know it's a lot. So I'll get on top of that right now. And then if you have any questions, you have my cell phone number and you have Charlotte's cell phone number. So you just kind of will work through it. But I say it's 440 in Charlotte's the admin. So it's 440 in Atlanta right now. let us get this chopped up and edited tonight. We can get it out first thing in the morning. And then your social media, we'll just kind of share it and we'll go from there and see what we can do.
All right.
Oh, thank you so much.
Okay.
We appreciate that, man. I really appreciate that. That means a lot.
We got to help each other. That's the biggest thing we got to do.
Yes.
So we'll see what we
And my
can do.
poor mom, she did what she could, but she didn't know she was leaving. So we were the one. I mean, I have to take care of my brother. Can't leave him. You know what I'm saying? So,
It's-
you know, I'm
it's-
like, hey,
I'm with you. I'm with
that's
you.
his baby. He's been like that all his life. So we used to him, but I said, no, but where he's at, he's very happy, so I want him to keep him that way and keep his mind off things. So, in his mind, he think mommy, whatever, but yeah.
I'm with you. Okay. So we'll do what we can. I say, give me a second, give me till tonight to edit it up and then we'll go from there and we'll be able to see what we can do.
Thank you so much.
Appreciate it very much.
Thank you so much.
Thank you.
Thank you.
All right. Thank you. Keep your faith. Okay.
Thank you. Bye-bye.
Bye-bye.